Hello, my name is Jesse Yanis, and I'm in the United States military.
Okay, so first question. What is your perception of registered nurses?
My perception of registered nurses is that they're very hard workers, they're critical thinkers, they have the ability to really have a lot of knowledge and be able to apply them in emergency situations, as well as being able to have compassion for the patients as well too.
Okay. What are the most important actions registered nurses provide?
I feel like the most important actions that they provide would be to patient care, as well as being able to educate also the patient as well, um, and pretty much saving their lives.
Okay. What contact have you had with a registered nurse that has affected your perception?
So I'm married to a registered nurse, and seeing her go through nursing school for the past couple years and how much effort she put into studying, countless hours, very stressful uh, nights, and then as well as very hard tests that they come through, made me realize that a lot goes behind being a registered nurse.
Okay. Last question. What other experiences have influenced your perception of nursing?
So being in the military field, for us, seeing our nurses in a deployed environment, being put through such strenuous like fields and stuff like that, how much they're willing to do to be able to provide care for the patients is kind of makes me like have more higher respect for nurses.
Okay. Thank you. A lay's individual perception of nursing often falls short in reality. They usually underestimate how complex and important nurse's job really is, often thinking that it's about just the basic tasks like checking vitals, giving medicine, or just doing assessment. They tend to ignore the crucial part of nursing, like making really tough decision, critical thinking, standing up for a patient, advocating for a patient, and just providing care that's considered the whole person. This misunderstanding often comes from nurses and how they are shown in movies and TV shows, which tend to oversimplify what they really do and really miss out on the responsibility that actually comes with the job. Shows like Grey's Anatomy and other movies often show nurses as side characters who are just doing basic tasks, which can give a pretty limited view on what job really is. Gender stereotype also comes into play since nursing has always seen as a woman's job for a long time, which makes it look easy to overlook how tough the profession really is. On top of that, if someone hasn't worked in healthcare, they might not understand the complexity and skills involved in nursing. Um, to add on to that, social media has really changed how people view nursing. It gives nurses a chance to share their experiences and knowledge directly with public using short films or YouTube, as well as TikTok and Reels. This can help break down old stereotype, but it sometimes show negative views depending on what gets posted during times like COVID-19 pandemic. It really helped paint the more realistic picture of the profession, with nurses being celebrated as the frontline heroes. Still, there are still valid concerns about privacy issues and importance of behaving responsibly when online to keep nursing image positive. Nursing has come a long way over the years. What used to be seen mostly as a basic domestic job is now recognized as a skilled and respected profession. This change is largely thanks to one of the pioneers like Florence Nightingale, who highlighted the importance of cleanliness, good nutrition, and passionate patient care. These days, nursing includes all kinds of specialties, from pediatrics to critical care, and it really just focuses on advocating for patients' needs. This shift shows just how important nurses are in today's healthcare system, making it a valued professional in our society.